Hi, we're Nia and Marianne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every Friday where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too. So if there's something that you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon. Good morning, Marianne. How are you
Hi,
today?
Nia. How are you? It's pouring with rain, and I'm very happy to be in my dry little cottage.
Very nice. Well, it's not quite summer yet, is it?
No,
Never mind, it'll come soon.
no, it'll come back, won't it?
I hope so. Otherwise, I'm going to be really annoyed in August. But anyway,
Yeah.
okay, so
What are
good.
we talking about today?
Well, really good topic today, I think. And it's from a listener question. So it was a great
Okay.
topic. So I thought we would explore it a bit more. So it's a little bit of a health fad, and we're going to talk about whether it's fact or fiction. And
I love that. A bit of myth busting.
yes. So the topic is about testosterone supplements and
Oh,
whether or not
yeah,
they can help men lose visceral fat,
because that would be nice.
wouldn't it?
Yeah,
Sounds magic.
yeah.
And really, so the question is, should all overweight or obese men be
Golly.
taking testosterone supplements to help them lose weight if that's what they
I
are
just
after?
just the thought of it. Golly, wouldn't you have a lot of angry men about?
We should talk about that.
Okay.
So apologies to the ladies listening. It's not really about you today, but maybe this will help you too with the men in your life. So it's not all wasted, is it?
Although the supplementing testosterone is also obviously very prevalent in women with menopausal
It
symptoms,
is,
but
and
that
we
is a
will
separate issue.
we
But
will touch briefly on that, I think.
okay,
Yeah. Okay.
so what's it all about? What is
So
testosterone anyway?
yeah, so let's start with what it is. So
Yeah.
testosterone, as most people know, is the most important sex hormone in men. So its production is controlled by both the brain and the testicles. So that's really important to know. And most people already know that you start to produce testosterone in puberty. And from about 30 years old, your levels start to decrease.
Oh, that's interesting. So
So
about the
that's
same time as your muscle mass. Okay.
it's essential. It's an essential hormone for
Yeah.
developing and maintaining your male characteristics.
Yeah.
And as we already sort of touched on, women do have some too, but we just have lower amounts.
Okay.
Um, it does have effects on your sexual function, obviously, because it's
Yeah.
a sex hormone, but it also has important effects on your heart and blood vessels. And so cardiovascular disease risk is affected by testosterone. So if you have lower levels, there
Yeah.
is an increased risk of cardiovascular
Oh,
problems
that's
and early death.
interesting.
So there
So
you go.
like all these things, it's quite wide. I mean,
Yeah, I mean, there's more than one function
anything
to
to do
most
with
hormones.
hormones
Yeah, yeah,
is complicated.
it
Okay.
is. Yeah.
So there's a medical condition we need to be aware of there if you're talking about risks increased?
Yes, yes. So, you and I both have seen prescriptions and
We have?
for testosterone. So there is a medical condition called ugh, called hypogonadism, which is where men are not able to make enough testosterone, and that needs replacing. So there are a couple of reasons why you would need a prescription for replacement testosterone.
Okay, so these could be primary or secondary, presumably. So I presume it's quite rare for primary
Yes.
conditions.
Yeah, so you'll know that there's a couple of reasons why you
Yeah,
might not make enough testosterone. So primary issues, either people who've had an issue in the testicles or damage to them. So things like
yeah,
injury or cancer or undescended testicles, genetic diseases, mumps,
yeah.
things like that. So there are primary reasons why function doesn't work and needs replacing. And then you also get secondary causes, but the secondary causes are related to the brain. So the primary reasons are related to the testes and the
Okay,
secondary related to the brain.
right,
So if you've got secondary deficiency, it's because you've got a problem with your pituitary gland or your
right.
hypothalamus.
Yeah,
So you can have things like benign tumors
yeah,
or HIV and AIDS can affect
yeah.
the hypothalamus, and actually some medicines too.
Oh,
So
okay,
some painkillers, some opiates, some hormones can affect
that's
testosterone production.
interesting. I wonder if
Yeah.
people are ever told that.
Interesting. Yeah, I'm not sure. So
Not that
yeah.
I've ever seen. Okay.
So
So,
there's
right. So, for men without a diagnosis as they get older, surely their testosterone levels drop anyway.
Yeah, so you get the medical diagnosed
Yeah.
category of men, and then
Yeah.
everybody else who's got no condition at all.
Yes.
Um, as you get older, as I said, so
Okay.
starting at 30, it starts to drop, and from 40 years, it drops by about 1% each year, your levels of testosterone.
Okay.
And so I looked up a study just to see like how prevalent low testosterone was, and they said it affects about 2 in 100 men between 40 and
So low,
79.
you mean lower than you would expect.
Yeah.
Okay.
So true testosterone
Okay. Because
deficiency.
there's
So
the grades of low. Yeah.
yeah. So but it's important to note that it is more common to see lower testosterone in men who are overweight and men who are in poor general health with long-term health conditions like
I could
diabetes.
see that's connected, but so something to do with visceral fat?
So yeah, remember the original question was, should men who are overweight or obese take testosterone
Yeah.
supplements?
Okay.
And here we see that men who are overweight or who have long term health conditions like diabetes, have lower testosterone.
But is this chicken or egg?
Exactly. So, this is exactly what I thought. So, scenario A is, does low testosterone cause you to store more visceral fat? And
Yeah.
therefore, increasing your testosterone will help you
Yeah.
lose
That
it.
would be simple. Yeah.
Yep. Or scenario B, putting on weight affects your testosterone levels. And
Okay.
therefore, the more weight you put on, the lower your levels become. And so, if you get rid of the visceral fat, your
Yeah. So you
testosterone
can't be
levels.
sure which one does which.
No, exactly.
Okay. All right. Great question. And I suppose as ever, it's not very simple.
It is not.
No. I can tell.
So, there's a lot going on here.
Okay. So,
Well, yeah, so we need to kind of discover what testosterone does and how it sort of works.
okay.
I did a little PubMed search and found this
Yeah.
great abstract from a study which I thought explained it really, really well. So it says low testosterone levels are frequently encountered in obese men who do not otherwise have a recognizable
Okay.
hypothalamic pituitary testicular axis pathology. So, in
Yeah.
other words,
Yeah.
in men who don't have any primary or secondary cause, like we just
Yeah.
spoke about, they commonly, if they're obese, have low testosterone
Okay.
levels.
I get that.
Yeah. So, and the reason that this is
Yeah.
the case is that from moderate obesity, you get a decrease in circulating testosterone,
Yeah.
okay, due to insulin resistance,
Okay.
which affects something called the sex hormone binding globulin.
Do you think this is transferable to women?
We won't go there now,
No. Okay.
but
We
I
maybe look
will
at that.
say that sex hormone binding globulin is something
Yes.
we all have, men and
Yes.
women.
That's what I was
And
thinking.
there are conditions like polycystic ovary syndrome,
Yeah.
which bear a similar
Okay. So maybe we'll
significance here.
expand that one day. Okay.
Yes. Okay.
So
So
insulin resistance, always at the bottom of everything, honestly,
I know, isn't it funny?
isn't it?
I got really excited when I read that because I thought, oh, here we go again.
Yeah, it all makes sense
It all
then.
makes sense.
Golly, you've got to sort out the insulin resistance really primarily.
Yeah. So when men put on weight and they
Yep.
put it on around their middle, we increase the visceral fat, we see insulin resistance, meaning that our bodies respond, don't they, when we're insulin resistant
Yep.
by releasing more insulin to get those blood sugars
Yes, of
down.
course.
And
Yeah,
this
yeah.
in itself causes a reduction in this sex hormone binding globulin. And that's important because that globulin controls the amount of hormones in your blood and determines which tissues those hormones can access. So it's basically like a transporter. So if you can't transport your testosterone around your body as effectively, then overall you'll have
In
lower
lower
levels of
levels.
testosterone.
Okay.
Then you get into this lovely little cycle
Cycle. Okay. So
of
you put on more weight then,
yeah, low
basically.
testosterone, increased visceral
Or more
fat,
visceral fat, yeah.
more visceral fat, more insulin resistance. Okay, so then
Less testosterone.
see, can you see? It's like a
Yes.
self-perpetuating cycle.
Yes.
So
Very interesting.
and then when you put on more and more weight, you also get this additional reduction in the free testosterone levels because it starts to suppress the hypothalamus and starts to sort of become a secondary cause. So you can totally see
Yeah, how
why
this works.
this works.
And so the good news is, I
Yeah.
suppose, if you supplement those people with
Yeah.
testosterone, would you stop the cycle? So would you start to reduce visceral fat, start to increase insulin sensitivity? Would it go the other way?
So this is really interesting, isn't it? Because you can see
Yeah,
why people have jumped on this bandwagon and said, "Oh, all we need to
absolutely.
do is
Yeah, just
supplement
take some
testosterone."
testosterone. Yeah,
So, obesity-associated
yeah,
hypotestosteronemia, so that's
yeah,
basically what it's for,
yeah, exactly.
is reversible, but it requires substantial weight loss. And this is really important. While testosterone treatment can lead to moderate reductions in fat mass, so it can help you,
Yeah,
unfortunately, replacing the testosterone by itself on its own without symptomatic deficiency is not an indication. And the other thing, of course, is that once you start supplementing people with hormones,
you get nothing for nothing, my
yes,
famous saying.
your
Well,
famous
you
saying,
start to muddy the water, don't you?
you do. And the thing that I think most people don't think about when we talk so freely about hormone replacement, and I'm
Mm.
not knocking it, please
No,
don't
no, sure,
think
but it's become a sort of, why don't you just replace the hormones and then everything else will sort
will
themselves
follow.
out? Yeah.
Yeah, and this is really important. So
Yeah.
there are some side effects to testosterone therapy.
Okay.
So
Well, I always knew
you
that, but that's always why I've been a bit wary about it.
Yeah, so there are things like acne, which isn't very nice, and oily skin,
Yeah, yeah,
worsening sleep apnea, so that's when you are
yeah.
sleeping and unable to breathe, benign prostatic hypertrophy, so that's when your prostate
Prostate
gland
gland.
becomes
Yeah.
larger. It's not a cancer. It's really common actually as men get
Yeah,
older,
most men get a bit of a bigger prostate,
but
yeah.
it affects urinary flow, and that's when you get like the dribble and you can't
Yeah.
fully empty your bladder, and that in itself can be painful or life
Oh, you could get urinary
constricting.
tract infections, yeah.
Absolutely. It does actually potentiate the growth of prostate
Of
cancer in men
cancer?
who already
Yeah.
have prostate cancer. It can cause something called gynecomastia, which is
Oh, yeah.
enlargement of breast
Breast
tissue,
tissue?
which
Yeah.
men don't typically like.
No, they don't like it, no.
Testosterone itself can cause shrinking of the testicles and a reduction in sperm count.
And you would have thought the opposite.
You would, but it's not.
Okay.
It can cause overdevelopment of red blood cell
Oh,
production, which
yeah.
increases your risk of blood clots.
Of
So
course, yeah.
really not good. Going back to the beginning thing you said about
Yes.
angry men.
I've always sort of vaguely, the men who do weightlifting in gyms, and
Oh,
I've
yeah, no.
always been vaguely, aware of the fact that they can be angrier.
Yeah, so increased anger and aggression, though not necessarily physical aggression, but just
Yeah, they feel enraged. I've always
they
thought
feel
about
enraged. Rage. Yeah.
rage and testosterone.
Yeah. So
Yeah.
that's that. And
Okay.
then worsening of heart failure in people who already have, men
Okay.
who already have heart failure. But here's the really, really important thing. There's a lot, so those are the side effects, but
Yeah.
there are contraindications, which
Okay.
means you are not allowed to prescribe for people who already have these conditions. So
Yeah.
patients who have male breast cancer,
Yes.
prostate cancer, severe heart failure, those who have something called a raised hematocrit, which means
Yeah.
that they make a lot more
More
red
red
blood cells anyway.
cells.
And
Yeah.
really, really importantly, which I think is not talked about often enough, particularly when we're considering the age of these men that this is targeted at,
Yeah.
men actively wanting to conceive a child in the future.
Because
Okay.
you need to keep that sperm count up.
Absolutely. So we know, don't we, that men go on often to have children in later life.
Yeah, sure.
And we know that
Especially now.
the age of men and women now having children
Yeah.
is much later.
Yeah, yeah,
So
yeah.
if
So
we're
it's
talking
important.
about middle-aged 40-year-old men being told to replace their testosterone, that's really important to consider
Mm.
if you want to have children in the future.
So there's a huge drop in fertility in both men and women, and
Yes.
that's maybe another podcast in itself, but that's quite interesting that more, people who are overweight will have lower testosterone
Mhm.
levels.
Mhm.
So it would all link up, wouldn't
Does
it?
all link up. So I think this comes back to what we talked about when we said about HRT,
Yeah,
that just because there are
yeah,
naturally occurring hormones that we can replace
yeah.
doesn't mean that we should, and doesn't mean that there aren't risks associated
And
with
doesn't mean it's
replacing
the
it.
answer to the whole thing.
No, exactly.
Okay. Did you find any studies to tell you that?
I did. Yes. So
Aha. course you
I,
did.
I want to talk to you about this particular study that I found that was an
Okay.
Australian study because I think this is really interesting and
Right. Okay.
illustrates the point. So we know that testosterone therapy does help diet and exercise induced weight loss. There is scope for more trials, but one of the trials that I found that did this is a very small one. It was
Yeah.
randomized, double blind, parallel, placebo controlled.
So
Okay.
all good things.
All good things. There were 100 participants.
So pretty low
Pretty low.
sample
Okay.
size. Okay.
Yeah. They were all between 47 and 60. They were
Okay.
all obese men with a BMI over 30.
Right. Okay. So you're looking at middle-aged and older who are
Yep.
starting to lose testosterone anyway, who are
Yep.
obese, and what were their levels like?
So this is really fascinating. I've read quite a few NHS treatment protocols recently.
Yeah,
You'll
I
be
bet.
delighted to know.
Yeah.
And it seems to vary between different laboratories what
Well,
they sort
that's
of
true of all the
use,
hormones.
of course.
Yes.
But really, what they're saying, there's a slightly different reference for age.
Yeah.
So they take lower levels
Okay. Into
above
account.
50,
Yeah.
they count. But basically, anything between 5 and 31 nanomoles per litre
Is
is
normal.
normal.
Okay.
And these men in this study were all around 12. So they were measured
So
as
the lower end of that normal.
at or below 12. So on the lower end, but not
Not
clinically deficient.
okay.
So we wouldn't treat them in the UK for
But that's a
testosterone
whole nother
deficiency.
podcast, and we've touched on that before. Yeah.
Yeah, yeah, okay.
We're not
So,
talking optimal, we're talking normal.
yeah.
Okay.
So they are experiencing lower levels of testosterone because they're
Yeah.
aging normally
Yeah.
and they're carrying extra weight, which,
Which adds another dimension.
yeah,
Yeah.
yeah, absolutely. So,
Okay. So what happened in this trial then? One arm had testosterone, the other placebo, I presume?
yes, yeah.
Okay.
So these men, remember, who would not normally be treated with testosterone, were either given 1,000 milligrams or 1 gram of testosterone or a placebo following the dosing schedule of
Okay.
testosterone replacement that you would follow if you were deficient. Okay.
Right. So they were over treated for what they wouldn't have normally been
Yeah.
treated at this point.
Yeah.
Yeah.
So that's
Okay.
important to note.
Yeah.
The diet that they followed was a
Ooh.
very low energy diet. So it had, this was
Oh
in
golly.
Australia. So they used a product called OptiFast, which is a
Oh
shake.
yes.
So basically, they had 640 calories a day
Yeah.
and 2 cups of non starchy veg. And
So a really low calorie diet.
and I'd like to put that into perspective because that is incredibly low.
Incredibly
So
low.
the
Yeah.
people that we put through the NHS type 2
Mm.
diabetes pathway to remission have 900 calories a day.
Yeah.
Okay. These people had 640. And the 2 cups of non-starchy veg
Oh,
will have
for
added
fiber.
minimal,
Fiber.
minimal
Yeah. Yeah.
calories. They are for fiber, yes, but a minimal calories.
So a real starvation diet.
Yeah. And they did that for 8 weeks
How did the people stay in the in this
in this
thing? Did
trial.
they pay
Interesting.
them a lot?
I didn't
I
actually
mean,
read if they
that's
paid
a
them.
tough thing to do.
It is tough, isn't it? So
Yeah.
weeks 1 to 8 were 640 calories a day and these
Golly.
2 cups of veg, and weeks 9 and 10 were gradual reintroduction of other
Okay.
foods. And thereafter, for the remaining 46 weeks of the trial,
Yeah.
they had 1,350 calories a day.
So still really low.
Still really
This is the
low.
same as the Minnesota
Like starvation
starvation
thing.
trial.
Yeah, absolutely
Golly.
fascinating.
Okay. So this is another. I mean, this isn't only about testosterone then.
No, so they are looking at the effects when you do it with diet and exercise. So, in
Okay.
addition to all of that, they also had moderate intensity exercise
Right.
for 30 minutes a day.
Okay. So there's a lot to unpack here because this is actually not just testing testosterone.
No,
I mean,
it's not
how do you sort one thing from
from
another?
the other. So, this is really interesting. So, everybody lost weight, as you would
Well,
expect,
not
placebo or
surprised. Yeah, or
otherwise.
left the trial,
Yeah.
presumably.
So the question is really, did the testosterone arm of the trial lose much more weight than the
Okay, so
placebo
that's the
arm?
question. Okay,
Yeah. And were there other benefits to support the fact that if you had the testosterone, it was
okay,
worth it?
yes.
So what do you think?
Well, interestingly, you always think about muscle mass, don't you? And one of the things that happens when you lose weight at that sort of level is you'll lose a fair amount of muscle mass,
Yeah.
which in itself is slightly problematic, as we know. So
Yes.
did the people with testosterone sort of protect their muscle mass a little bit? Because we sort of know that as your testosterone levels decrease as you age, that you're losing muscle mass as well. So is there a connection?
Yeah. So very good. Well done. So remember the small sample size. In the end, only 82 men completed this trial. I
Well,
think
sounds
82 out
pretty
of
good,
100 is
actually.
not bad at all,
For a
actually.
trial like that, I think that's pretty good.
Yeah, I mean, they must have paid them. I might go back and check actually,
Yeah,
but I
they
just think,
must.
why would you do that? Anyway, it did
Anyway,
show that those who had the testosterone lost slightly more weight than the
okay.
placebo. So 2.9 kilos basically was the additional weight that you would
Yeah,
have
they might
lost.
have also been less tired. I mean, there's so many factors in there.
Yeah. And they
Okay.
did lose less muscle.
Yeah, okay.
Okay.
So
So
that's interesting.
we knew that already, didn't we, though? Because we knew
Yeah,
that when you lose weight, you lose fat and
yeah,
muscle because the
of
body will
course.
do whatever it can to get
Yes,
energy.
yeah.
So, although it proves this study, remember, small sample size, not a great study
And
overall.
also a whacking dose of testosterone.
Well,
I mean, is
yeah,
that a normal dose of testosterone?
this
I
is
mean,
a
that, yeah,
this is a replacement
placement.
dose for
Exactly,
people
which
who've
is
got
different to a
nothing.
supplement, isn't it?
Yeah, absolutely. So I wouldn't say that at the end of this study, I was convinced that this is strong enough evidence that every overweight or obese middle aged man should have a whacking great dose of
No,
testosterone.
there's too many unknowns to me.
Mm.
I mean, if
So,
you were on the other end of this, would you take a whacking dose of testosterone
not if I'd read the
to
list of
try
side effects.
to increase your weight loss by what percentage? I
By
mean,
2.9 kilos, I mean, does it feel
no, anyway, there's something quite fishy here.
so? Yes. So if we go back to the original question, should men be taking testosterone
Yeah,
to boost weight loss?
yes,
I think the answer is not really enough evidence to say, is there?
yeah,
And the risks might outweigh the benefits.
yes, exactly. That's what I'd say. I'd say be careful.
Yeah. And we know that because of insulin resistance, actually, that it's all related.
Yes,
Tackling the insulin resistance itself is
yes,
probably more important.
exactly. So as you lost weight on a whole food diet, maybe not a starvation diet, and you
Yes.
increased your insulin sensitivity as your visceral fat decreased, everything would get better anyway.
Yeah. So, isn't it fascinating
Yeah.
how a testosterone has become the answer to the problem, a bit
Yes.
like the GLP-1s?
Yeah.
Oh, I love a bit of magic,
Yes.
but
But
it's
it's
not.
not.
No,
So in some men who have a primary or even secondary proper
cause. Yeah,
deficiency, it's
yeah,
different. But to tell men in general
that
who
you
are
need to take
overweight
testosterone. Yeah.
to take a supplement, which is, I mean, is it even testosterone that we're talking about?
So let's again even more explore this because it's
Yeah. So
fascinating. So
what are they sold?
yeah, so one of the first things I want to point out is that you cannot get testosterone unless you get a prescription from your doctor. Okay.
Okay, not anyway.
No,
Okay.
it's a prescription only medicine.
So
You
what you
and
selling them?
partly the reason for this is because it's a deep intramuscular injection. So it goes
I
really deep
see.
into your bottom.
So
Okay.
you're not going to be able to do that on your own that easily.
No. And can I just point out that intramuscular injections are the most painful,
Yeah.
well, apart
Yeah.
from
Yeah.
intrathecal, which goes in between your vertebrae, but they are incredibly painful. I've had when
Mm.
my youngest was born, he had to be brought out early, so they had to give me steroids to
Oh
mature his
yeah.
lungs.
Yeah.
And it was only zero point 0.2 mils of steroid that went
But it
into
was
my
so.
deltoids, but yowzers,
Yeah. Yeah. So it's not exactly an easy
it's not an
thing to
easy route.
administer.
No. Okay. So
Okay.
anyway, so here's the question now. We've got this whole narrative that we need to boost men's
Yeah.
testosterone. And so men are going to the doctor and asking for testosterone replacement. But at the same time, we've got these adverts. And now, can I just point out that my Google ads are screwed up and my Facebook ads are screwed
Because you're
up?
getting loads of adverts for testosterone.
Yes,
Yeah.
I am. So thanks for that, cookies. But anyway,
Yeah.
so there are lots and lots of adverts for testosterone supplements, which you
Yes.
wouldn't be remiss to think are giving you testosterone because
And
of how
actually
they're
they're not.
no. So some really clever names like testosterone support, testosterone
Yes.
booster, T
Yes.
booster, and anything that sounds like testosterone, like turkesterone, and lots of owns sort of
Yeah.
saying, making the general public feel like they're getting testosterone, but actually are not. So here's where it's very exciting. And I thought, I got really excited about this because this is the kind of thing I like to
Yes,
poke
of
pins in.
course, of course. And you know the stuff. So,
Yeah.
I mean, most people who read these ingredients wouldn't have a clue.
No, so this is where they become really clever. They
Yes.
go, oh, this one contains ZMA. Do you know what ZMA is?
Haven't a clue.
Zinc, magnesium, and vitamin B6. Woohoo!
Really? Which you should get in your diet.
Which you should get in your diet. And
I
if
mean,
you
that's the
really,
whole thing of supplements anyway, isn't
yeah.
it?
And if you really think you're deficient, you could just take the cheapest multivitamin and get all
Yeah,
three of
yeah.
those.
And you'd get the same.
Exactly. But just ZMA sounds so much more
But what
magic.
about the placebo effect? You forget that.
Yes, I'm sorry, I've forgotten that. Okay. So
I mean, if
that's
you buy a
hilarious.
very expensive supplement and it
Do you
says
know
things
how
like
much they
that, I
cost?
think it might be very potent. But there you go. That's me, placebo. Go on. What else is in
To
there?
get your ZMA, something called D-aspartic acid, which is an amino
Ooh,
acid that is naturally made by the body. So you don't
okay.
actually need to add more. You just need to eat a
And it probably
well-balanced
doesn't
diet.
do that well in a bottle anyway.
No, your body will make it for you. Very clever, but it
Okay.
is. Something called Tribulus terrestris extract.
Oh,
Okay. This is a plant that's used in Chinese herbal medicine.
okay.
It
For
is actually supposed
boosting
for boosting sexual
cell
function.
function. Yeah, but you laugh, but I'm interested in the Chinese medicine, and I think some of this is believing it.
Yeah, okay. So I looked it up and there are no studies that prove it increases testosterone
What
in
a
men.
shame.
Sorry.
Okay.
One study found outright that it didn't, and another one found that it increased testosterone in animals, but they couldn't reproduce
Make it
that in
do
a
it
human
in
population.
That's really
Sorry.
disappointing.
I'm so
Okay.
sorry. Okay, and then these are the other things that I found in other supplements. Um, I apologise for my appalling pronunciation.
Yes.
Ashwagandha extract,
Sounds
luteol-
it sounds clever.
luteolium phytosome, which is from chrysanthemums, apparently.
Oh yeah. I've always eaten chrysanthemums.
Have you?
Mm.
and
Yeah, we
fen
used to eat them a lot when we were kids.
oh, and fenugreek, which you can just
Fenugreek.
put in a curry, can't you?
Oh, fenugreek, yes. The
Yeah.
spice.
So, look,
You
there's
looked
some
for the
there's
evidence?
some evidence in inverted commas, but there are always small studies. They're usually in men
Yeah.
under 40, for
Okay.
which, we know they're not really
No, deficient
relevant. They're
anyway.
classed as non-clinical anyway. There's not much research. There's a huge variation in dosage, extracts, small sample size, etc.,
Okay.
etc. So there's actually no evidence to suggest that any of this works above and beyond following a complete healthy diet. Okay,
Yeah, so basically we're back to
back to
back
square
to the
one.
same thing.
My usual proviso with vitamins and supplements
Yeah.
is if you think that you are deficient in any vitamin or mineral, okay, and some people are because
Yeah,
they
yeah,
don't eat
yeah.
a
Well,
very
they
good
have
diet.
reasons to
Yeah,
be.
oh,
Yeah.
they have reasons to be. You may as well take the cheapest multivitamin that you can that will meet your nutritional needs. It's
Okay.
really, really important
You're
not
such
to
a
take.
pharmacist,
I
aren't you? I
know, I'm
mean,
sorry.
really, why not the expensive one? Because surely they work better psychologically, if for
Nope.
nothing else.
They just love
Okay.
think about all the lining of their pockets. Honestly, it's really important not to take high doses of anything, especially without any medical advice, because
Yeah,
you
of
can
course.
actually cause yourself more
Yeah.
problems. And interestingly, again, it's important to note that the MHRA, which is the Medicines Health
Yeah.
Regulatory Agency in the UK, had an investigation into some muscle gain products and
Oh,
found lots of them were being sold with they were being tainted with steroids and stimulants and hormones.
so you weren't getting what you thought you were
You
getting.
weren't getting what you thought you were getting. And
Okay.
again, we go back to those risks right at the beginning, the side
Yeah.
effects, unregulated anabolic steroids, testosterone, things like that.
They have definite
Serious
dangers.
side effects,
Okay.
people will die.
Yeah.
So
Or
that's
get
important.
aggressive.
Yes, yes. But I think death is probably worse than aggression. I'm
Well, I
willing
don't
to
know.
fight you on that.
The two could be linked.
They could
So
be. Yeah.
what are we concluding from all of this in a nutshell?
In a nutshell, so there is evidence to suggest that adding testosterone could have a beneficial effect to protecting muscle mass and helping with weight loss in men who have lower levels, but it's inappropriate to be treated with testosterone unless you have a true deficiency. So it's not a magic bullet, Shane.
Right.
Also, really importantly, what is being sold as a booster doesn't contain testosterone, isn't really any more effective than a standard multivitamin or a whole foods healthy diet, and is, in
Yeah.
my opinion, an expensive way to try and lose weight.
It's really interesting, and I knew very little about this, but I can imagine if you were desperate to lose weight and you saw a supplement that promised you a very easy way of
Of doing
increasing a hormone that would help you to lose weight. And if you looked at a supplement and you weren't very au fait with marketing, it would be so easy to go down
yeah.
the
So this
wrong
is
path, wouldn't
this
it?
is
Because,
on a par, isn't it, with so the person that sent this in to me,
yeah,
when they sent me the email, they
yeah.
said it's coming up on all the podcasts I listen to as like an
So
advert,
it's a
and
sort of fad.
said, I believe this is rubbish, but I'd like to know more. And I thought,
Mm,
I agree. But it's just like those
mm.
green powders that come up on all the
Yes, I've
podcasts.
got some of those in my pantry actually, way out of date now, but um we even the best of us get done, you know.
We have to go down to the
Mm,
brass tacks and think a little
mm.
bit more cynically. And are we actually being sold a pup? And in this instance, yes, you are.
I've taken a few of those things in my time.
Oh,
Anyway,
we
we
all
won't
have.
go there, but I was thinking of making some green lollies actually. To use up the green powder that's in my pantry. And because it's
Oh,
definitely going to be transformative, I'll leave it all there at that point. But
of course.
so you're not alone out there if you think you've been had.
Yeah. Yeah.
Only Nia doesn't get had. She'd be
Well,
reading all the ingredients and saying, I don't think this is true. I'm going to look this up on PubMed. The rest of us just go, oh, yeah, give me some of that. Because it sounds like it's very expensive, so it must be good.
mm,
I'm having that. Yeah.
I'm sorry.
Anything easy, to fix a thing.
Well, yes, I'm just as vulnerable to anything easy to fix a thing.
Well,
You asked me
not
how many
quite
kitchen
though.
gadgets I've bought over the years.
We all have our Achilles heels, but I suspect what you put in your mouth might be slightly different because you've got the very rigorous scientific training of
And a natural cynic.
you want the evidence. The rest of us are much more suggestive. Give me that easy, quick fix, and I'm off. Yeah,
Yeah.
lovely. Well,
Sorry.
that was really great. Thank you.
I had fun finding that out. And yeah, good
Yeah, it's
question.
really interesting, and the whole supplement world, of course, is a huge minefield.
Cool. Right. Okay. So I shall see you next week.
See you next week. Yeah.
Bye.